Welcome to part 18 of training muscle lengths, the weird stuff. This is the final video of this series. Our next series will be Is This Supplement BS, where we take requests on supplements and look at the literature on them. So make sure you're following if you want to learn about supplements, and if you want to know more about how to actually apply this muscle length stuff, we do have an ebook coming out on how to implement it to your training, as well as a completed training plan that you can follow. So be on the lookout for that in the next couple weeks here. And final shameless self-promotion note, you can buy this merch online. Check it out in the bio. Get ready for some rapid fire here. Tibialis anterior, or tib anterior, as in the front of the tibius. There's no such thing as a tibius. I meant the tibia, but I'll just leave it in there so you can see that even people who do this for a living make mistakes. Runs from the side of the tibia up here down to the foot. Main function is dorsiflexion, which is pulling your foot up towards your shin. Lengthened when the foot is plantar flexed, like you're pushing on a gas pedal, and shortened when you pull that toe up towards the shin. You can train those positions with a fancy machine like this, or with a kettlebell like this, dumbbell tied to your foot, tib bar like you've maybe seen before, or even bodyweight like this, although we do want to load it over time. Next, the most requested strange muscle, the sphincter. JK, we ain't talking about that, and that was just a zoomed in picture of a donut. Popliteus, little muscle that crosses the knee joint running from the femur to the tibia. It's a knee flexor that contributes to the very beginning of knee flexion when the leg's straight. People will call it the muscle that unlocks the knee because of that. If your leg's straight, it's lengthened. As soon as you start bending, it's getting shortened. Not something you'd really train for hypertrophy. QL, that's the quadratus lumborum. It runs from the iliac crest up to the 12th rib. It also attaches to some of the lumbar vertebrae. It's a big time stabilizer for the spine and pelvis. It is a spinal extensor, so when both sides contract, it'll extend the spine, and when one side contracts, it'll cause lateral flexion, but only the lumbar region, and you know what that means. The QL is important for twerking. We train it on something like a reverse hyper, where we have lumbar flexion, it'll be lengthened, and then when we come up into lumbar extension, it'll be shortened. Piriformis runs from the sacrum and ilium over to the greater trochanter of the femur. It's one of our 6 big external rotators of the hip, but also contributes to abduction of the hip when we are in a flexed position. It would be shortened with abduction of the hip, especially when it's flexed, and lengthened in adduction when these legs come back together. Friendly reminder that this will not give you a big booty. This is not a glute max movement. Thanks for following along for this series. Reminder that we have that supplement series coming up, so you could comment any supplements you want to learn about here or wait for the part 1 video of that.